I'm Dr. Ryals.
Hi, I'm AJ. Nice to meet you.
Hello, Dr. Ryals. I'm Camilo.
Hi. Okay. So why don't you tell me about what brought you in today?
I don't know. Recently, I've been feeling kind of down. I've been out of it. I haven't been coming to work the past couple of days because I wake up and I feel miserable, and I don't know. I can't really put my finger on it. I don't know why.
Yeah. How's your appetite been?
Come to think of it, I'm not really eating that much either. Just kind of like oatmeal in the morning.
Yeah. Okay. And sleeping?
I'd sleep too much. I think I kind of just lay around the house. Like when I missed work, I didn't do anything the entire day. I didn't take my dog out. I just stayed on the couch, and I didn't even watch the TV. I was just sitting there.
Okay. Have you felt like this before?
I did a while ago in high school. Maybe I was just down.
Just like periods
It wasn't.
of...
Yeah. It wasn't as bad as now though. I don't know what's going on.
Okay. Is there any family history?
Well, yes. Our mother, she had major depressive disorder.
Okay. So can you tell me a little bit about like what your major stressors are, or like what's bothering you in life right now?
Our mom, she's in the hospital a lot because she's getting chemoed for cancer, and she's not doing that well. And I don't know, maybe it's affecting me somehow.
Yeah.
But also I'm a bus driver for high school, and it's the kids.
Yeah. I understand. I understand what you're saying.
It's not a good work environment. I don't know. I don't enjoy it.
Okay. What kinds of things are you enjoying in life right now?
Well, my brother, he's always there. He's got my back, and I think I've relied on him a lot through this time.
Yeah. What kinds of things do you guys do together? Like,
Well, usually I take him out for walks with our dog, or we usually like go out and play sports or anything.
Yeah.
Just something to keep him entertained.
That's good. And about how often do you think?
We usually go like 2 times a week.
Okay. Right. So, do you take any medication?
No, just when I'm sick, cough medicine.
Okay.
That's fine.
About how long has this been going on?
I don't know, like 2-3 weeks maybe.
And it hasn't been letting up any?
I just feel down.
Is it getting worse?
Some days it's okay, and sometimes it's not.
On the bad days, do you ever, make any suicidal attempts or anything like that?
I thought about it a couple times.
I understand if this is hard to talk about. Why don't you tell me about what happened?
Well, one day we were in my house, and I heard a noise, like something dropped upstairs, and I was curious, so I went upstairs, and the bathroom was locked, and so I had to like slam the door open, and I caught him almost like overdosing on drugs, and yeah, that's how it mostly went.
Yeah, I bet that was terrible, but he didn't, right? You caught him.
He didn't. Thank God I did.
Okay.
I wasn't thinking. It was just a rush of the moment, and I wouldn't have done it. I wouldn't have done it.
Okay, so next I want to just do a couple of little tests. I just want to measure your intellectual functioning. So first, I just want you to write any sentence that comes to mind. Here's a paper and pencil. Just whatever.
Any sentence?
Okay. Okay, perfect. All right. Next, I'm gonna give you a word. I want you to try to spell it backwards. Can you spell train backwards?
NIART.
Good. Okay. All right. I'm gonna give you 3 words. Just I want you to try to remember them as we do the rest of this. And at the end, I'm gonna ask you the 3 words again and see if you remember. And it's okay if you don't.
Okay.
So your 3 words are snake, bush, and stop. Okay.
Snake, bush, stop.
Mhm.
Okay.
All right. And at the end, like I said, I'll just ask you for those words and just see if you remember them. Next, can you just count backwards from 15 for me?
15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Okay. At home, have you seen any difficulties with him reading or writing or anything?
Well, usually he doesn't read much,
Okay.
but I do sometimes notice that he is messing up verbally. He doesn't really give a proper sentence.
Okay.
So that's what I noticed in our house, and when we go to buy things in supermarkets, when the cashier is talking to him, his following of directions is not really good.
Okay.
So I have to help him out.
Okay. All right. Do you know where you are right now?
I'm at the clinic right now.
Mm-hmm. And do you know what time it is?
It's around noon.
Yeah.
Okay.
Okay. And what's the date today?
Today is April 17th. It's a Tuesday.
Yep, that's good. So, are there any other things that you've been noticing?
Well, one day I was hungry and I ordered his favorite food, being pizza, because he hasn't been eating as much as lately. And when the pizza came, I offered him some, but he refused all the time. He didn't eat from till breakfast to around lunch and dinner. So it really started worrying me.
What about sleeping? Have you noticed anything?
Well, I usually go to work at 9 a.m. or so, and he was sleeping by that time. And I went to work. I came back around 4 or 5, and I went to check up on him, and he was still sleeping. And I told him to get up, let's go do something, but he just never he just said that he wanted to stay in bed. He hadn't eaten anything. He was practically just wanting to sleep.
Okay. Okay, so earlier I asked you to remember 3 words. Can you go ahead and recall those for me?
Yeah, snake, bush, stop.
Okay. Okay, so based off of what you've told me, I think you have a major depressive disorder.
Okay.
And what we can do for that is we're going to give you SSRIs, we're going to give you Prozac, because you have lower serotonin levels. That's what it is. And Prozac will help balance everything out and make you feel better again. You're going to take, it's a daily pill, so you're going to take 20 milligrams in the morning. If you start to feel anything different, if any new symptoms arise, or if your symptoms get worse, let me know immediately and we'll find a different treatment option.
Will this cause him any harm?
One of the side effects is increased suicide risk, so when he is taking it, you should keep an eye on him for the first probably month until he gets used to it. But this medication, it works in most people, and the increased suicide risk, it really isn't a big concern. Just keep an eye on him. If you see anything unusual, let me know, and like I said, we'll find a different treatment.
All right,
Okay.
Sounds good. Thank you.
You're welcome. All right, it was nice speaking with you.
Thank you very much. I really appreciate it.
You're welcome.
Thank
Thank you.